Why are we sending people who have COVID into nursing homes? It's insane.
New at 10, hospitals discharging infected patients sick with the coronavirus, and they're being taken to nursing homes to quarantine and recover. But KTVU found that's increasing the opportunity for the virus to spread among the most vulnerable. Our investigative reporter Brooks Giroux looks at how patient transfers to one facility have led to a massive outbreak.
She was just so beautiful. I mean, she always dressed, I always called her my model aunt. You know, she always looked like a model.
Daisy Mattis had just celebrated her 94th birthday, showered with gifts of love at the place she called home for years, the Gilroy Healthcare and Rehabilitation Center. But soon,
then we started getting these horrible robocalls.
One resident tested positive for COVID-19.
The coronavirus got inside and exploded.
What do you think?
Oh my God, I was freaking out.
Debbie Timms and her sister, fearing for their aunt, started looking for a new nursing home and planned to move Daisy.
But there wasn't enough time. From the day that I got the positive test results, she died a week later.
Daisy is one of nearly a dozen who have passed away here.
My mother just passed away 30 minutes ago. Being in this facility was not good.
Other families visiting one last time just to collect their loved ones' belongings.
I think they should take responsibility for all this, for everything that's happening.
The nursing home is owned by Covenant Care. The company told us in early August it opened a COVID-19 recovery unit, an isolated wing with its own entrance, then started accepting COVID-positive patients from hospitals, 32 so far.
It's akin to having a match thrown into a vat of gasoline. You've got the most vulnerable.
Tammy Abreu Butron's mother will soon turn 87 and just recently contracted the virus at the nursing home, a place she's lived for a couple years.
I have such guilt, but I had no choice, and now she's in a situation where she has no choice.
She's one of 75 residents who were infected. The skilled nursing facility has just 132 beds.
Do the math. That's more than 50% of them have become infected.
But KTVU found this nursing home was cited and fined last month, all for failing to report COVID-19 outbreaks 3 separate times. Management says it was just a miscommunication that's been fixed.
No facility wants to reveal that information because it hurts business.
Mike Dark is an attorney with nonprofit California Advocates for Nursing Home Reform. He says most places aren't prepared, even with state guidelines.
The problem is very few facilities actually have the staffing, the PPE, and the good infection control records that allow them to do that safely. And so what we have instead of strong rules is a kind of Wild West.
In fact, the state excused the Gilroy facility from having to comply with minimal staffing requirements. And Covenant Care reports 54 healthcare workers have gotten sick with the virus, mostly after infected patients came from hospitals.
Why are we sending people who have COVID into nursing homes? It's insane.
In August, the California Hospital Association wrote this letter to the Department of Public Health, pushing for patients to be released and recover in nursing homes to free up bed space.
Hospitals have strong economic incentives to use those beds for things like elective surgeries, which can make them a lot more money. And so business interests are making a lot of the public health decisions, which we're seeing play out so disastrously all around us.
The state and Santa Clara County refused on-camera interviews, but documents show the California Department of Health urged skilled nursing facilities to prepare to receive COVID-19 patients.
I had no idea.
Genevieve Corbin says nursing home families were given no choice and got little communication. She's worried her husband, who's already ill, could soon contract the coronavirus.
Every single person that's in there has a human right, get me started on this, for their families to be told exactly what's going on, how their family's doing. I've got nothing of that, so I'm angry. I'm very angry.
And it's that pain that has brought these families together, sharing stories of then and now.
I still feel that sense of danger. I still feel that sense of urgency that somebody has to do something. There's people still there.
And for those families, the nightmare isn't over.
My biggest fear is that I'll lose her. I'm sorry. And I won't be able to hold her, tell her how much I love her, and to not be able to talk to her is so hard. I mean, I'm sorry.
Covenant Care turned down a repeated request for an interview, but did say all 23 hospital patients transferred here have since made a full recovery. I'm Brooks DeRose, KTVU Fox 2 News.